Good afternoon. Today I will be talking about my internship at Stone Dental Lodge. So, a little bit about me. My name is Olivia Hall. I am a health science studies major with a concentration in pre dental, and I also have a minor in biochemistry. About the agency, it is located in Bozeman, Montana. And I selected Stone Dental Lodge because Dr. Stone is somewhat recently out of dental school and she started her dental practice from scratch. So I felt like that was a good opportunity to talk about a more recent experience in dental school and how she came about starting her own practice. My primary role in the office was assisting, turning over rooms, and charting. If there was a new patient, I would look at their x rays that we just recently took and I would chart their existing work. The goals that I had set for this internship were understanding common oral diseases. I was able to learn about common diseases such as periodontal disease, which I did my project on. I was also able to learn about common causes of cavities and as well as bone abnormalities in the mouth. I was also able to gain an understanding of general dental procedures in that general dentist would see on a daily. Dr. Stone did many fillings in crown work. Those were the most common thing that she ran into. Excuse me. I was able to develop professional communication skills that were beneficial in a dental setting. I was able to bring back patients and learn how to talk to them and keep up small talk while Dr. Stone was reviewing their x rays. Another goal of mine was to learn the roles and importance of the assistants and the team as a whole. I observed the way that the office worked together and what worked and what didn't work. A big thing in a dental office that was primarily consisting of females was communication is very important. Um, I was also able to elevate my understanding that of the dental tools that were used in certain procedures, such as fillings or crowns. They are very different, especially on the types of material that is used. So a typical work day for me was I would come in around 7:45 in the morning and turn on computers and TVs. I would bring the speakers in to turn on music and set out any necessary tools for our first procedures. At 8, the patients would start to show up. Throughout the day, I would assist Dr. Stone if she needed. If I wasn't assisting, I would be turning over rooms that we had just used, or I would be in sterilization, cleaning, and bagging used tools. Around 12, we would go home or wherever for lunch. We'd have a lunch break, and we would come back around 1 to pick back up with our patients and procedures and continue out our day. At 5, we would be done and we'd be closed, and I would start to break down the rooms, clean them, set stuff up in sterilization, and then I would clean the lines where our suctions and stuff was like that was used to make sure that everything is clean in there. For learning opportunities, I was able to learn about the differences between dental and health insurance. This is really important since insurance can be complicated and complex, and it really can sway your patient population depending on who you are in network with. I was also able to learn about taking good x rays. This was pretty challenging as well, especially for the full workups that we called FMXs, where we took x rays of the entire mouth. And that was quite challenging to get used to, but I did learn nonetheless how to take a good x ray. My project was a brochure that covered periodontal disease. The contents of this brochure were what is periodontal disease, what causes periodontal disease, the different stages of periodontal disease, how to treat, and who is more susceptible to periodontal disease. So here is the front side of my brochure. I learned about what specifically caused periodontal disease and how some people are more susceptible to periodontal disease. Typically, as you age, you become more susceptible to this disease. And some people can be more susceptible or prone to periodontal disease and not have many issues with their teeth. And so they won't have many cavities, but they will have more issues with their gums and vice versa. Some people might have more issues with teeth and cavities, and they have perfect gums. It really varies on the individual. The benefit of this brochure was showing patients what can happen if they don't practice good oral hygiene. A lot of people just kind of think that if they don't brush their teeth, they just have bad breath, but there's a lot that goes on in the mouth and lots of bacteria, good and bad. And the less that you practice good oral hygiene, the more bad bacteria tend to grow and cause issues such as periodontal disease. A major problem of periodontal disease is bone loss. Bone loss is huge in this, and as you let the disease grow and fester and progress through the stages, it will reduce the bone even more. And bone loss in periodontal disease or in the mouth is not reversible. You cannot bring back bone that has been lost in the mouth. You can try to bone graft the best that you can, but typically, most of the time, what you have lost is gone and you cannot build it back. Here is the other side of my brochure, and it goes more into the different stages and shows how they chart. They typically take this tiny little probe and they stick it in between the tooth and the gums. And depending on how deep, there's lines on the probe, depending on how deep the probe goes, shows the severity. The deeper that the probe can go, the more severe that the loss is. There are different things that you can do that are listed on the brochure that show the patients what they can do if they do show up to have periodontal disease. The only one that is reversible is gingivitis. It is just inflammation of the gums and irritation. There is no bone loss, but it can be treated. But if this is left untreated, it will go into periodontal disease and cause issues. Skills that I wish that I had going into the internship was a crash course on insurance. I found that quite challenging to wrap my head around. Insurance is very complicated, so if there was a little bit more knowledge that I had going into my internship and just terminology of insurance, that would have been helpful to gather. My strengths and weaknesses going into my internship was that I picked up assisting Dr. Stone rather quickly. She was very pleased that it was not a huge learning curve for me. I also found it easy to make small talk with the patients and to help them feel more comfortable at the dental office. I did see that there were some patients that felt very uncomfortable in the chair. And so just being able to connect with them was awesome, and just kind of learning their stories as they waited for Dr. Stone to come in to talk to them and what brought them in was a good experience. And I found that rather easy for me to pick up. One thing that I did have some challenge picking up was learning the different technology in the office that we use, such as the 3D scanner. That is very complex and very hard for me to pick up. It's taking a 3D, a bunch of images in the mouth. It's very finicky. So honestly, I found that the old school molding of impressions was a lot easier than taking the 3D. But as we get more technological with things, obviously we have to learn how to use them. So it was a good experience. At least I got to learn how to do that now. So going into dental school, I had a little bit of experience with some of the tools that I'll probably be seeing in school. And my experience at Stone Dental Lodge was truly amazing. Dr. Stone was awesome. She let me try many different things. Everyone in the office was super welcoming. It was honestly an amazing experience. And I am so happy that I got to land with them. So, yeah. Well, thank you. This was my presentation on Stone Dental Lodge and my experience. Thank you.